Expert explains why you should clean your tongue twice a day. This is by Dilip Sharma, scientist. Has your doctor asked you to stick out your tongue and say ah while the GP assesses your throat? They're also checking out your tongue, which can reveal a lot about your health. The doctor will look for any changes in the tongue surface or how it moves, and this can indicate issues in the mouth itself as well as the state of your overall health and immunity. But there's no need to wait for a trip to the doctor. Cleaning your tongue twice a day can help you check out how your tongue looks and feels and improve your breath. And what does a healthy tongue look like? Your tongue plays a crucial role in eating, taking the other vital functions. Talking about other functions, it's not a single muscle, but rather a muscular organ made up of 8 muscle pairs that help it move. The surface of the tongue is covered by tiny bumps that can be seen and felt, called papillae, giving it a rough surface. And these are sometimes mistaken for taste buds, and they're not. Of course, 200,000 to 300,000 papillae are only a small fraction containing taste buds. Adults have up to 10,000 taste buds, and they are invisible to the naked eye, concentrated mainly on the tip sides and the back of the tongue. A healthy tongue is pink, although the shade may vary from person to person, ranging from dark to light pink. A small amount of white coating can be normal, but significant changes or discoloration may indicate a disease or other issues. How should I clean my tongue? Cleaning your tongue only takes about 10 to 15 seconds, but it's a good way to check in with your health and can easily be incorporated into your teeth brushing routine. You can clean your tongue by gently scrubbing it with a regular toothbrush. This dislodges any food debris and helps prevent microbes building up on its rough, textured surface. It's almost like cleaning off a carpet, my dentist told me. Now, or you can use a special tongue scraper. These curved instruments are made of metal or plastic and can be used alone or accompanied by scrubbing with your toothbrush. Your co-workers will thank you as well. Cleaning your tongue can help combat halitosis, stinky breath, obviously. Tongue scrapers are particularly effective at removing the bacteria that commonly causes bad breath hidden in the tongue surface. And what's that stuff on my tongue? So you're checking your tongue during your twice daily clean and you notice something different. Noting these signs is the first step. If you observe any changes and then you worry you, you should talk to your GP. And here's what the tongue might be telling you. A white coating. Developing a white coating on the tongue surface is one of the most common changes in healthy people. This can happen if you stop brushing or scraping the tongue even for a few days. In this case, food debris and microbes have accumulated and caused plaque. Gentle scrubbing or scraping will remove this coating. Removing microbes reduces the risk of chronic infections, which can be transferred to other organs and cause serious illnesses. A yellow coating. This may indicate oral thrush, a fungal infection that leaves a raw surface when scrubbed. Oral thrush is common in elderly people who take multiple medications or have diabetes, and it can also affect children and young adults after an illness due to the temporary suppression of the immune system or antibiotic use. If you have oral thrush, a doctor will usually prescribe a course of antifungal medication for at least a month. A black coating. Smoking or consuming a lot of strong colored food and drink, such as tea and coffee or dishes with turmeric, can cause a furry appearance. This is known as a black hairy tongue. It's not hair, but an overgrowth of bacteria, which may indicate poor oral hygiene. Pink patches. Pink patches surrounded by a white border can make your tongue look like a map. This is called geographic tongue. It's not known what causes this condition, which usually does not require treatment. Pain and inflammation. A red, sore tongue can indicate a range of issues, including nutritional deficiencies such as folic acid or vitamin B12, diseases including pernicious anemia, Kawasaki disease, and scarlet fever, inflammation known as glossitis, injury from hot beverages or food, ulcers including cold sores and canker sores, burning mouth syndrome. Dryness of the tongue. Many medications can cause a dry mouth, also called xerostomia. These include antidepressants, antipsychotics, muscle relaxants, painkillers, antihistamines, and diuretics. If your mouth is very dry, it may hurt. And what about cancer? White or red patches on the tongue that cannot be scraped off are long-standing or growing, need to be checked out by a dental professional as soon as possible, as do painless ulcers. These are at a higher risk of turning into cancer compared to other parts of the mouth. Oral cancers have low survival rates due to delayed detection, and they are on the rise, so checking your tongue for changes in color, texture, sore spots, or ulcers is critical. And this is from the conversation here under Creative Commons by Dilip Sharma, Professor and Head of Discipline Oral Health, University of Newcastle, UK, on Science Alert. Please leave your comments, and thank you for your support. Finally, support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.